everything that we say and do would be pleasing to you, and we appreciate the expertise of our guests today from Public Health. May we listen intently and follow their advice, and certainly we're open to instruction. Ask these things in Jesus' name. Amen. Roll call, Shelley.
Mike Dobbins. Here. Keith Austin. Here. Harley Buzzard. Here. Sean Crittenden. Joe Deere.
Honey.
Kanan Duncan.
Honey.
Rex Jordan. Daryl Legg. Here. Wes Snowfire. Dora Petzkowski. Here. Mary Baker Shaw. E.O. Smith. Here. Janice Taylor. Here. Victoria Vasquez. We have a quorum.
Thanks, Shelley. You may not have been aware, but we approved the minutes of this meeting in the May Health Committee meeting. I may, as a practice, as a chair, bring the minutes to the Public Health Subcommittee so that we can you can get update on what we discussed previously in the previous Public Health Subcommittee. Down to reports. It's up to Ms. Pivek or Dr. Gann to go first.
Good morning. It's nice to see all of you. Thank you for having us again today, and look forward to visiting with you about the public health programs. You do have our April-May report. You should have that, and I'm just going to highlight a couple of things on that report that I think are significant for you to have awareness of. One of the things that I am going to highlight is, if you look at the wings, we're still doing virtual races on wings, and the participation is as much or more than the actual races that we're having. So that has been, that we've been really pleased that our wings participation has remained high over that time. You'll also note that we are working on a cross-collaborative with Cherokee Nation Education Division. We're working with environmental health and a couple other programs to look at how we might cross-collaborate and make health a shared value and expand public health knowledge across those divisions. You'll also see on the last bullet, as you know, Deputy Chief Brian Warner is co-chair of the Tribal Advisory Committee for Centers for Disease Control and Prevention, CDC. And if you read through that, in the language in the Appropriations Act that was passed in December of 2020, it's pretty significant. It's actually very significant. I am not aware of any other agencies under DHHS that have this mandate now. And it is that the CDC's center, institutes, and offices, and there are 21 of those, have to have written guidelines for how they work with tribal communities and tribal governments, and they have to do that in concert with the Tribal Advisory Committee. So we have been working the last 2 months, every other week, going through presentations from each of the CIOs, taking notes, and getting ready to, as a subcommittee, write our recommendations. The ultimate goal of this is to integrate more of CDC into tribal communities and be at the level of the center, institute, and office to advise on how they may be able to improve technical assistance and all the other work that goes on in the country. We are also working on the overall tribal health assessment. That's for our public health accreditation, and we're getting pretty close to that. Now, as you remember, that is an overall large one is completed every 5 years and then updated somewhat annually. So you'll be seeing that in the next couple of months. We also completed the county's profiles. We completed 3 more, and we'll have the rest of the 8 at the August meeting. They need to be dressed up a little bit, but they're all about 9-page reports for the counties on physical activity, and health profile for your county has all of the parks and recreation activity, the information for your county from the physical activity survey that was done, some information from the Cherokee Nation health survey that we do, and some information from publicly available sources. So they should be we should be getting those to your email box or something in the next, hopefully the next week. It just requires a little bit of dressing up so that it looks a little better. Let's see, did I have anything else? As far as grants, we are still working on, in the progress of submitting 2 more. You'll see that the ones that we manage and do are right there under the list. We're also submitting NARCH 12 sometime this week and another CDC grant the week after for Social Determinants of Health Accelerator Model. The last thing that I have is that we are working with the Special Diabetes Program for Indians on getting the school grants and school grants program ready for next year. And we are waiting, a little bit of this is waiting on the agency, Indian Health Service, those funds come through that, and getting approved, the Special Diabetes Program approved funding for what they need, for what we're going to do in schools. But I anticipate that within the next couple of months or so, and we're already planning what we might be doing with schools over the next year. Those are the things I wanted to highlight. I'm available for questions if you have any. Be happy to answer them. If not, I'll pass. Oh, yes, Darrell, Councilor Legg.
Lisa, it seems like the last time we were together that Sequoia County had 37% vaccinated. And on this one it says 25.5.
That's a Dr. Gann question.
Gotcha. I'll wait.
And I'll let him speak to that. He's going to speak to your immunization information.
You want me to come back?
Okay, we're meeting with our realtor tomorrow. See what she says, because I think that they're gonna tear out.
Anyone?
Mary, you have your mic on.
Wait, they're calling me, hang on. Hang on. I'm trying. No.
Councilor Shaw, did you have a question for us? Okay. Are there other questions related to the report? Or Dr. Gann's going to visit with you about COVID-19 vaccination and where we are in the efforts right now.
When do you know?
No questions?
Okay, thank you, Lisa. Let's stay close here because it might come back to you.
Yes, I'll be right here.
Dr. Gann, thank you for coming.
Thank you, sir. Good morning. It's good to see everyone. So just a quick COVID update.
Okay, and this is the 23rd.
Globally, cases are kind of plateaued at a decent level. There are several countries that are in trouble. Indonesia, Russia is going up very rapidly. Most of South America is doing poorly. The United States is doing pretty well. I think that right now, to kind of predict what's going to happen in the United States, we need to watch the United Kingdom. Right now, they're at about, I think, 11 or 12,000 cases per day, up from 2,000 cases a day about 6 weeks ago. They have about the same vaccination rates as we do in the United States. The difference right now is they're predominantly the Delta variant. 90% of the cases in the UK are the Delta variant. And in the United States, we're at about 10% are the Delta variant, and another 10% are the Gamma variant, the one from Brazil. And so, and that proportion is doubling about every 2 weeks. So wherever the UK peaks, I think is what will happen in the United States. But hopefully that's far enough distant that we get more people vaccinated and we'll be able to blunt that surge. In Oklahoma, the last several weeks, cases have been going up. We were down, averaging below 100 cases a day, and now we're up to about 173 or 72 yesterday. So it's a slow increase. The piece of paper I handed out, the graph with the blue bars, that shows the weekly cases at Cherokee Nation Health Services. And you can see the last 3 weeks, they've been going up. We're up to 55 cases this week. Our week goes from Sunday to Saturday, so we still have several days left of this week. Most of the cases are among unvaccinated people. We have had a few vaccinated people test positive, and we're seeing that those people, most of them, they've had prolonged contact within their household with someone who's sick and hasn't been tested until the rest of the household gets sick. So it'll be interesting to see where we peak there. Now, we're still at a low number. When things were bad, we were averaging 200 cases a day. So this is still pretty low. Our hospitalization rates in numbers at Cherokee Nation are steady and low, 2 to 4 patients on any given day admitted to the hospital. In the state, it's between 100 and 120 patients, and it's been steady for 6 weeks. And in Tulsa, we worry most about Tulsa because that's where we send our sick patients that we can't care for. They've been between 50 and 60 census every day. So the question about the vaccination rates, I don't remember exactly which data I showed you before.
Dr. Gann, I think I understand, because that was probably just for the adults in Sequoia County, but now that
Okay.
you add the 12 and under to the total,
Yes, sir.
it's going to bring it down.
Yeah. So
Okay.
the 4 columns that are there, the first column is the percent of the total population for everyone who lives there. And this is not just Native Americans, it's the total population. And then there's 12 and older, 18 and older, and 65 and older in each column. Every week, those numbers are going up anywhere from 0.5 percentage points to 1.5. Adair County had a really nice jump this week over like 1.6, 1.7 percentage points going up. So we're making progress. Overall in the state, the vaccination numbers have dropped the last week, but they're still out there. Still, of course, we recommend the vaccine. It's really what's going to stop this. What we're seeing in our cases now, it's has to do with summer youth camps. A lot of kids are coming home sick, and then it's spreading in the household, and then family gatherings. So it's still spreading in our communities, and it's getting a little bit worse, but it's not overwhelming our systems at all. I don't think there's anything else on COVID. Any questions?
One of the things that came up last month was we had a mandatory vaccination for our kids that were playing playing sports at Sequoia High School. I think kind of a key thing too far as our rates dropping on overall vaccination is what had come out. It seemed kind of timed perfectly with what came out of Wuhan, China, with the laboratory and the whole. Everyone talks about it. You can't deny that everyone now knows that, there's a lab that played a part in this virus, and
Sure.
So the vaccination decreased. Is there some more statistics, or I guess not statistics? Is there some more reviews that we can get out to the public that the CDC is putting out there that would make people a little bit more comfortable about the vaccination? Because if you're concerned about, wow, crap, this thing was actually designed in the lab, now I'm skeptical about the vaccination, and that's what I see a lot of people in my district. They're not taking the vaccination just purely off the fact that what came out of the investigation on this disease out of China.
Yeah, we can try to push some stuff out. I hadn't made that connection. I hadn't heard that since the virus possibly was manufactured, that the vaccine is suspect as well.
Yeah, that's kind of been the thing. It's the narrative that goes on. It does make you scratch your head and go, okay, well, that's a bit concerning, a laboratory-created disease, and now, since it had been artificially engineered,
Yep.
What about the disease itself, mRNA vaccination that hasn't been out but 2 years? How can we get people to understand the safety of it, especially with kids? Because
Sure.
Do we have anything out from the CDC on when we're going to know long-term effects of this vaccination to our youth? Because it's in a trial period.
Yeah, it's going to be continuous data collection for years and years.
Okay.
So, yeah.
And then far as I had read, I don't know, is there I guess there's a 2-month, I guess where we're reviewing the kids that get the vaccination, right?
Right.
So whenever we get the vaccination to Sequoia kids, are we reviewing them?
No, we're not individually following the children at Cherokee Nation who get the vaccine. I know with adults, CDC offers to track you, right? I don't know if when you got the vaccine, there's the V-Safe program. Is some of the literature you got probably, if you got vaccinated with Cherokee Nation, and once a week you get a little text message and just send it back. So we're not doing anything specifically for the children, as far as
Okay.
I know, yeah.
So I guess who would because I asked the director of education who would be doing that, and he acted like, well, I just now found out about it, that we got to have a 2-month monitoring on the kids that get the vaccination. So I didn't know if that's something that had already been brought to you guys, or you guys were already aware of it.
No, I haven't heard that.
Okay,
Yep.
all right, appreciate it.
Yeah, you bet. This is hard stuff. You know, I think we have a lot of our communities are just forgetting about the vaccine. We've had a few kids who have gone to seek health care outside of our system and were sick, and they're tested for strep throat. The strep test was negative, and they were given antibiotics and not tested for COVID at all till they stayed sick, and then they came to Cherokee Nation to get tested. So parents are forgetting, and some healthcare providers outside of our system, that COVID's still out there, and the numbers are going up. So we'll keep track and see what's going on. The good news is the state public health laboratory is now able to do a lot of variant testing, and they've asked for us to send them as many samples as we can. So we'll be able to track what's happening better with the variants in Oklahoma. We just don't have good data right now. Very few tests have been done since it's become available, but their lab is up and running full steam and ready to go.
Appreciate it. On the Sequoia, just one quick thing on the Sequoia High School thing to touch base on. I don't know if y'all have been in discussion with the administration on that. And I don't know, and Todd's sitting back there too, but it might be worth trying to figure out how to better, maybe if, since you guys are in public health, to get more, I guess, documents that kind of make those students that are over at Sequoia High School that are having to make that decision a little bit more comfortable with it, because they're not as comfortable with that mandate on kids while it's in a trial vaccination
Sure.
period. So it's a concern to make that as a mandatory thing. So I'm trying to figure out, okay, what do we do here to kind of ease that tension there between students who are dropping out or not wanting to go to school because they're getting mandatory vaccination when there's no other schools that's doing that? So I thought maybe that might be something that your team could look at doing, is trying to help out to ease that a little bit. So,
Absolutely.
all right, appreciate it.
Yes, sir.
On our elders, when they ask about a booster shot, what information should we give them on that? What about time frame on the booster shot?
Yep, so the decision hasn't been made by CDC of whether or not a booster shot will be needed. The companies are developing them just in case. So it looks like now the prime reason to get a booster shot would be if our immunity from the original shot starts to go down. We don't have enough data yet to determine that. Then they're still studying how well the current vaccination protects against the variants that are predominant, the Delta variant. And so far, that looks really good. So there's no timeline on a booster shot. So probably, it's what the experts are saying, that probably, but no timeline.
Dr. Gann, what is our advice to those that are naturally immune, they've recovered? Are we still advising them to get the vaccine if they're if they've had the disease, they've recovered?
Absolutely.
They're carrying
So
natural antibodies.
we have really good data that having been infected with COVID-19, you're protected for about 90 days. And we know that people who get very sick with the natural infection have a more robust immune response and might be protected a little bit longer. If you didn't get very sick, it'll be a little bit shorter. We do recommend that once you've recovered from that initial infection and are no longer contagious, that you get vaccinated then. There are some rumors spreading that if you've had COVID and you get vaccinated, that you will react strongly to the immunization, and that's not true. How harshly someone might react to the vaccine is rather random. Some people have no side effects and others do, but the side effects are very, very short-lived, 24 to 30 hours with the patients I've worked with. So we still recommend vaccination. The real difference is that you can predict the immune response to the vaccine. You can't predict the immune response to the natural infection. What concerns me a lot is what happened in Brazil when the Gamma variant showed up there. People who had been previously infected with the original strain or variant of the virus were still very susceptible to the Gamma variant. So we do have that in Oklahoma. We've had 41 cases, I think, that the state health department's identified. So the vaccine is more broadly effective, based on the current data. And we know right now it's at least 6 months of protection. CDC is saying you're good for a year, but that's about the length of time that the original study group has been vaccinated. So we're watching closely, and CDC is gathering the data. And CDC is not going to make a recommendation unless it's based on science. If it's not, they're going to tell you that we don't have a recommendation. This is what we think is going to happen, but we'll tell you when we have enough data to back it up.
Does this virus, like other viruses, they don't like hot weather?
It's not quite like that. It's not so much that the virus doesn't like hot weather. What we see with other viruses, that are spread by droplets, depends a lot on humidity, not just the temperature. And then if the weather's pleasant, then we're outside. But then when it gets too hot, we all go back inside. So it has a lot to do with how people are gathering more than anything. So that's, I'm concerned about when school starts again, what's going to happen. If we can get enough adults vaccinated in the adolescents, it shouldn't be an issue. But yeah, it's more of the way we congregate than the temperature itself.
Thank you, Dr. Gann. Harley?
Yeah. Dr. Gann, what are the symptoms of this new variant that's out there? And where is it mostly concentrated in Oklahoma, or do you know that?
So the state's not reporting county numbers to us, but if you look at the data, the state sends all their data to CDC. CDC maps show that northeast Oklahoma is not doing very well compared to the rest of the state, but it moves around. And next week we could be doing better in some other place in the state. We do know that rural Oklahoma is doing a little more poorly than urban Oklahoma, based on how the Census Bureau defines that. So that's being tracked by Oklahoma State University very closely. Now the symptoms, they're really what they've always been, and there's a long list, and that's why it's so hard. We've had people whose only symptom is pink eye, right? Coronavirus can cause pink eye. Some people just have upset tummy, nausea, and diarrhea, and that's the only symptom they have, and it's coronavirus. The most common symptoms, runny nose, congestion, sore throat, and a cough. The Delta variant seems to predominate this upper respiratory symptoms. Sicker people will get a fever. You'll see sudden onset of extreme fatigue, like profound fatigue will just come on all of a sudden. There are some people that get a rash that go with it. So any combination of those symptoms, and those symptoms could be almost any viral or bacterial disease that we run into. But we can get tested for COVID, very easy. So that should be part of anything. And I think the number one rule with COVID from the very beginning is if you're sick, you don't go to work. Go and get tested. And we've had several cases of people who are sick that go to work and don't get tested for a day or two or three. Then they test positive, then we have a mess.
Yes, Dr. Gann, how is it the variant determined? Is it based upon where it came from or some
Right.
other significant COVID thing?
So they
understand.
sequence the RNA genome in the virus, and they identify it as something unique, and as it spreads, they find it more. Originally, the naming convention was where it was first discovered. And it's like the Spanish flu from 1918 started in the United States in Kansas, but we didn't tell anybody. It was the Spanish who first said, hey, we've got a flu virus here, so they call it the Spanish flu. So WHO, to kind of prevent some of the things happening around the globe, have used the Greek alphabet to name the variants instead of using where they were first identified.
Thank you.
Yes, ma'am.
For Dr. Gann or Lisa? Okay, I guess we're good, Dr. Gann. Thank you. I had a question for Chief of Staff, if he could come in here for a moment. Todd, I was wondering if you could just tell the committee on we designated the 7.5% wellness fund for substance abuse / preventive measures. Could you kind of tell us when that's going to be available for us to begin projects?
Yes. Sorry. So we've asked behavioral health and public health. We did a forum with several of our public health team. I'm trying to remember how many we had, probably 45 or 50 participants on that call, where we gathered feedback and gathered ideas from members of a public health team and interested parties. We also did a similar thing with behavioral health staff, and we actually had some citizens participate from California and Illinois, I want to say. We had several participants there, so we've been gathering feedback. But both public health and behavioral health are working on their reports, which is due to this body by September 30th. I think we'll be ahead of that time frame, and coming up with a master plan of how we begin to tackle this based on need and where we need to focus our efforts. So I would say probably within the next 45, 60 days, you'll have the report, and then we can start working together and figure out how we're going to solve some of the challenges in front of us.
Any questions for Todd? Thank you, Todd.
Sir, if I might,
Yes.
based on some of that discussion, I would like to share with you my personal story regarding COVID. I actually contracted the virus in January, and I had been tested several times because I felt like I had probably been exposed through interactions with citizens for one reason or another. I had several phone conversations with Dr. Gann. Sometimes it was assisting citizens that came into the complex. One fell ill and passed out, and I was helping render aid until EMS got there. But I had several experiences where I felt like I was in a high-risk situation. But I don't know how I got it in January. I had no known exposure. I had no known experiences where I felt like I was at risk. But began feeling ill, went in, got tested, and sure enough, tested positive. Compared to many of our citizens and many of our employees, my symptoms were fairly mild. Severe body aches. I had mild fever. My pulse ox probably got down into the low 90s, but didn't dip below low 90. Severe itchy eyes, short of breath, really aggravated my asthma. So I felt like I was much shorter of breath and lacking of oxygen than what was really happening. But I isolated in my home and took over the living room for 2 weeks. And I received some therapy in the clinic, and if it hadn't been for that opportunity, I could have experienced much greater symptoms than what I did. So the reason I want to share this is I have lingering issues, most notably joint and muscle pain and fatigue. I just get winded pretty easily. I used to run a lot, was very active. And I don't have the same energy. I don't have the same stamina. And so it's slowed me down quite a bit. And the one good thing that's come out of this is I suffered from insomnia on a regular occasion. And I got into the regiment that I took melatonin every night to, one, fall asleep, and then my major dilemma was I could fall asleep for 30 minutes, and then if I woke up, I would be up the rest of the night. And so I would take melatonin to stay asleep the entire night. And since I've had COVID, I don't have to take melatonin because I will pass out at 10 o'clock on the dot. And if I do wake up, I immediately go back to sleep. So, I wanted to share that with you on this body, and then anybody that may be listening from somebody that experienced it and also received the vaccine. I had no major symptoms from taking the vaccine. I had a sore arm, and that was about it. My entire family has made the decision that they want to become vaccinated. We didn't push this on any of our kids. They are 21, 18, and 14. And they've all made the decision that they made that independently and asked us. If you guys would like to discuss that any further, or I know some people out there that have experienced COVID on at least 3 occasions. I can't imagine what that was like, and they wound up in the hospital every time. So I want to once again thank our health and our public health team for the efforts that they've gone through, all to try and protect our citizens and give them this was before the vaccination was available. Yeah. So thank you for allowing me that opportunity. I just wanted to share you my personal experience and hear something other than what is generally made available. A lot of this is done through personal testimony and people sharing their experiences, and so thank you for allowing me the opportunity to share my experience. Pardon.
Thank you, Todd. Any other comments or questions? Okay, seeing none, I see no old business, no new business. Are there any announcements? If not, the next tentatively scheduled meeting is Thursday, August 26th at 11 a.m. I would entertain a motion to adjourn. Second. We are adjourned.